Hello, everybody. Welcome back to Psychedelics Today. Joe Moore here, joined by Alan Davis, Associate Professor at Ohio State University. Alan, are you the head of kind of the psychedelic department at Ohio State?
I am, I guess, begrudgingly the head of what's going on here. Although I have to say, like the work at OSU has been growing even since I got here and started things. So I know there's other folks now getting involved outside of our center, which is really exciting. But yeah, I've been the director of the center here since I got here in 2019. We launched the center in 2022.
Great. That's excellent. Not a bad place to weather COVID compared to
Yeah, not too
Baltimore.
bad. Yeah, I feel
Yeah.
like we kind of got out of some of the bigger challenges of some of the coastal cities for sure. Yeah, it's been interesting to me lately. I've been reflecting a lot on just how seemingly we all just kind of moved on from it, even though I personally feel like there were a lot of like psychological impacts that most of us, me in particular, I just haven't even like wrestled with. So I don't know. It's just been kind of curious of this topic of weathering something that we've all kind of communally gone through in some ways. I don't know. Just something that's been on my mind lately.
Yeah. It's going to be interesting once we figure out how to process it collectively.
Right.
So we're here today to share about a project that you and others are working on, trying to collect data from Ibogaine patients. It's called the Ibogaine Patient Survey. Could you tell us a little bit about what you're looking at there or trying to do?
Yeah, absolutely. As you probably know, and some of the listeners might know, we launched a series of Ibogaine surveys over the past 10 years and have been publishing data from those studies. First, looking at specific clinics in Mexico providing Ibogaine treatment largely to people with substance use disorders, specifically opioid use disorders. And then we started doing research with veterans, kind of looking at the veteran pipeline of folks who were going across the border to receive this treatment. And so, as part of that work over the past 10 years, we started to get interested in doing a clinical trial with Ibogaine. And we also realized we're not the only ones. There's quite a few people interested in pursuing clinical trials in this space now, which is wonderful because we're going to need a lot of them in order to eventually have approval in place for something like Ibogaine therapy in the US. But one of the barriers that we discovered in that process was at the challenges of how to be able to do a clinical trial with Ibogaine for a clinical population and get that through an approval process at the FDA to be able to do it. And some of the things that the FDA needs in order to do that type of trial are going to be safety data. They need to be able to know that there's enough safety in place to be able to launch that type of trial. And the way that we can do that most efficiently and expeditiously is to gather real world evidence of the type of safety data that they can incorporate in those applications so that when us or any other clinical research team wants to get approval to do a trial, that data can be used in order to justify, in some ways, maybe even skipping steps in the process. So typically how this works is, someone wants to do a trial of psilocybin, let's say. Well, an investigator doesn't have to recreate all of the data that's been, collected about the safety of psilocybin. They can use all the data that's been published to justify why they want to do this in maybe a new population. With Ibogaine, those trials haven't really been done. There's been very few trials completed in the US, and that safety data isn't really there in the same way, which makes it a lot harder for a new trial to come forth and to get the approval by the FDA to move forward with it. So what we're trying to accomplish with this survey, which we created in consultation with advisors from the FDA and other clinical teams, is to gather that type of evidence from everybody who's had exposure to Ibogaine in order to put together that type of information, be able to publish that type of data so that it can be used to grease the wheels of those processes for future trials to be able to move forward more quickly.
That's beautiful and reminds me of how MAPS was able to leverage a lot of historical data that they did not generate to work through the steps of the FDA and saved a lot of time and money as a result. And I think that's really important to have universities partner to like build that common knowledge base,
Yeah.
so that others
Well,
can use it.
for us, it really felt like something that we were really well poised to do because we had already been doing research in this space. We had a pretty good sense of who the major players were, and also had a good sense of what that data might need to look like, and from our best estimate, there's probably been, at least 10,000 or more people in the world who've gone and had an Ibogaine treatment for some reason, either for substance use disorder, or there's quite a few people going for other mental health challenges now, including things like cognitive impairment and TBI. So the nice thing about the survey that we've created to gather this evidence is that anybody, for any reason that they've gone to seek this treatment, can participate in this survey, and we can capture the type of data that we need in order to share that, not only with the FDA, but also to share that with other clinical teams. I think, often research, when it happens, in a way that really only benefits the researcher. Sometimes when the research is done well, it might also benefit the community. But I personally think that when we're kind of living up to the highest form of academic pursuit, it's also going to benefit other researchers. And we can actually start to look at how this could be unfolding in more of a collaborative way than it currently is. I feel like currently we're often siloed from other research teams and other progress, and in part because there's some of that, capitalistic, competitive kind of infrastructure built into academia as well. And it doesn't necessarily have to be that way. So that's something that also really excited me about this, was trying to break down as many of those barriers as possible to try to give this offering to other researchers in addition to the work that we want to do.
That's great. And can you speak a little bit about what was interesting enough about Ibogaine to make you want to do this patient survey?
Well, in part, I got interested in Ibogaine because of these real world reports of people. Back in 2016, there wasn't a lot of published research on Ibogaine at the time. This was before MAPS had published the kind of the New Zealand study and the Mexico study. And so at the time, my curiosity as a clinical psychologist and someone who has specialized in substance use disorder treatment primarily for much of my early career, and then moving into populations with co-occurring mental health and substance misuse. I was particularly interested in the seemingly kind of, for a lot of people, this miraculous reduction in craving and withdrawal symptoms that people were reporting. And so I got very interested in trying to understand, what is it about this specific molecule, this specific set of experiences, that seems to alleviate one of the biggest barriers to successful addiction recovery, which for a lot of people is the withdrawal. It's intolerable. It's for a lot of people unmanageable. Certainly without support, and a lot of the support that's currently provided to these folks in the U.S. is not sufficient to actually help them manage it. And the other factor being craving, that this desire to continue using, even with really strong intentions and reasons not to, is sometimes overpowering people's ability to navigate that in their recovery. And so the idea that something like Ibogaine can help with these two critical factors that get in the way of people's success is what initially brought me to being curious about Ibogaine. And it's one of the reasons why I've stuck with it. I also have had a pretty strong interest in veterans, specifically from my own background, being someone who was raised among parents who were veterans and grandparents who were veterans. I was raised, kind of seeing firsthand what it was like to be with people who had experienced trauma, who were experiencing substance misuse problems to a large degree because of their trauma and the things that were unresolved from their military service. And so that also is a strong interest of mine, is to understand, if this treatment is helpful, if it's safe, then wanting to make sure that the people who need this treatment the most, whether they're veterans or whether they're people in current substance use treatment who aren't finding the help they need from the current system, can have another option. And so that's led to my strong interest in this area.
Well, thanks for sharing that. Yeah, it's amazing sometimes to see just how poorly people are integrating back when they come back stateside. It's like, it's really tragic. And um, I'm somewhat excited. I don't know. I haven't dug in enough yet to what's going on in Texas to know if I love it. I think I might. But, this idea that um, we have to kind of if we're going to do war, which I would prefer we didn't do so much, we have to kind of pay for the whole cost of the thing, including taking care of those folks when they come back. So,
Yeah.
I'm excited that we're going to know more about Ibogaine and hopefully be able to bring folks back online sooner, back to their families. And, having the despondent parents isn't always ideal, or worse than despondent. Right.
Right. I mean, absent parents also challenging, but also just parents and people who are suffering sometimes in ways that they don't even realize. One of the things that I think is really interesting about psychedelics in general, and Ibogaine in this case as well, is the notion that it can help to reintegrate people's emotional processing system and give them access to skills and abilities to manage their internal experiences in ways that they might have been completely shut off or dissociated from. And how can you teach your child how to manage their emotions if you're disconnected from your own, and those are often, I think, the processes that are impaired that perpetuate ongoing substance misuse or mental health problems. And so whatever tool that we have, whether it's Ibogaine or another psychedelic or meditative practice or whatever the tools are that can help us to reintegrate into these systems that are well positioned inside of our bodies to manage these things, but we're just not trained in it. We're not given the education that we need as children, for the most part, especially in this country, to learn how to do that. And so I think what's interesting about veterans in particular is that, yes, a lot of them did experience these pretty challenging, traumatic experiences during their military service. But for a lot of them, their dissociation and lack of capacity to manage their emotional state often predates their military service. There's often childhood trauma that comes up. There's head injuries that happened in sport related activities before they even entered into the military. And so what's interesting, I think, about Ibogaine is, in addition to some of these capacities it might have to help alleviate some of the kind of more proximal issues related to mental health and substance misuse, like that craving and withdrawal, gaining insight about the reasons why they might be having some of the struggles they're having, is it also seems to have a pretty powerful anti-inflammatory effect. And what we've seen with some of our data so far has been for people who have been exposed to multiple traumas or exposed to years of substance use or traumatic brain injury, that there seems to be a cognitive improvement that happens as well, which I think is also I think inspiring to know that it might not just be a psychotherapeutic benefit that people are having, but it also might be changing something at the structural level that's decreasing inflammation in a way to help people think better and plan better and process information more effectively, which of course can, I think, do nothing but help them further in their recovery process.
Are there any mechanisms that we're speculating on around this inflammatory situation? Like, is it just lowered cortisol? Is it something more sophisticated? Or we just have no clue what to guess at this point?
I think a lot of it is just really speculative. I think we have some evidence to suggest that there are these kind of inflammatory biomarkers, these kind of inflammatory systems like cortisol, like you've already mentioned, that if they're overactivated for a long enough period of time, that that could that a decrease in that inflammation could help people in diverting resources biologically to other systems that really need it. But so much of this is speculation. I mean, really, what's going to need to happen is the ability for us to start doing very sophisticated clinical trials to really start to understand what these mechanisms are and test them experimentally. I'm someone who doesn't believe that that experimental studies are the only path towards knowledge, but we currently live in a society where they're considered the gold standard, and without them, we have very little ability to move the needle forward in terms of access, at least from a medical standpoint in the U.S. And so these trials are critical, and that's why this real-world survey is also critical in order to try to help facilitate that moving forward more quickly.
Yeah, absolutely. Um, so what kind of patients are you hoping to hear from in the Ibogaine world? Are you particularly, clinical trial folks, or people who have accessed it in retreats and assorted underground settings, or yeah, what are you hoping for?
So the nice thing about this survey and the type of data that we're gathering is this is meant for anybody who has had Ibogaine in any setting, whether that's been a retreat setting, a clinic setting, a clinical trial setting. This is also for anybody who's, already provided data for other projects. So, my team has obviously done quite a bit of surveying of different populations already. Any of those prior people can participate. Sometimes we hear from people like, oh, well, I didn't think I could participate in a new thing if I already participated in something else. But this is not the case with this study. With this study, anybody who's at Ibogaine in any setting is eligible to participate. And that data can be really useful to us. One of the other things that we've done for this survey in order to make sure that it's as accessible as possible is we've kept it very brief. We kind of anticipate on average, certainly no more than like 15 minutes, but in some of our testing, it was even as quickly as 5 minutes. So we've really tried to keep the questions as tight as possible, as direct as possible, and really just focusing as much as we can on what this safety data is that we can use for the FDA. So that way we're also not taking up a whole lot of people's time, especially if they've already participated in some other survey, or maybe they've done, they filled out surveys for the clinic they went to or the retreat they went to. They can absolutely do this as well. And hopefully it won't take a whole lot of effort for them to do it.
I have to say thank you for making a shorter survey. Some of these things are monsters, and for a good reason, right? But that's cool. 5 minutes or so, and like, that should really make for a pretty good sample size. I would imagine, right?
That's what we're hoping for. One of the biggest challenges that we've had with this project is figuring out how to get to folks, though. One of
Mhm.
the even though there's probably been 10,000 or more from what we can estimate, there's been more than that probably of people who've had Ibogaine experiences. Figuring out how to get in touch with them has been a unique challenge for this, especially because all of them are eligible regardless of when they had Ibogaine. Someone who went to have an Ibogaine treatment 15 years ago is eligible, same as someone who went yesterday. So figuring out how to get to most of those people are people who've had it years ago, and may not be well connected to psychedelic spaces, or may not be well connected to these clinic listservs or other things. So that's been our biggest challenge, is trying to figure out how to raise awareness enough about what we're doing so that we can try to get it into as many of those folks' line of sight as possible.
Yeah, I love that. Um, have you developed any kind of partnerships with retreats to help try to get this in front of their patients or clients?
We have been in a process of developing those relationships. I think one of the things that we've run into, and we're still kind of working to develop those partnerships, but one of the things that we've realized in the process is also a lot of confusion and a little bit of that kind of question of competitiveness. Like some of these, especially some of the big clinics, they do their own clinical data tracking, and so I think part of the question that we've had to try to answer for them is, why is this still important? And our answer for that is, we know that people, especially these bigger clinics, they want their data to support their programming. They want their data to support the work that they're doing. And for a lot of them, that data is, proprietary. They're using that for marketing. They're using that for other ventures, growing their clinics and other things. And we don't want this to get in the way of that, because the purpose of this is different. The purpose of this is to not get in the way of their own development processes and things that they're using their data for. It's really meant for a whole nother avenue of ultimately helping that process along, right? If we're able to do trials more quickly in the US, and get that type of data, and open up more options, it's really just going to benefit them in the long run as well. So part of that has been trying to help them understand the kind of the intention behind what we're doing. And again, a lot of these folks have been through other processes with researchers that have been more extractive, where researchers come in and take data and it's not shared or it's not used with this type of intention. And so part of what we're trying to do is dispel some of those other concerns that people that might have about what this is about and what our intention is behind it.
Well, I love the awareness there. I've had some people approach me. I don't even have like data that's that interesting at all. Like I have some podcasts, right? And like, not necessarily feeling any kind of reciprocal relationship can be problematic. Yeah, like, oh cool, you're gonna get one step closer to tenure, and what do I have?
Right.
So but some of these groups are gigantic, and I think having partners like yourself adds so much to the defense.
Yeah.
Say this is how we can understand what we're doing better and continue to collectively be safer.
Mhm. And at the end of the day, our main goal, in addition to be able to provide this data for, making these processes easier to get trials done, the other goal that we have is, this type of data can also just further continue to establish that there is safety, for this treatment, that people, especially when it's done with the right type of screening and in the right type of, medical environment, that people are generally safe. Like that's such an important message for us to be able to communicate more broadly than just the patient populations of people that are coming into these clinics. The type of data that we're gathering across clinics and across the world really, can help to also communicate to the general public, in addition to regulators, like what this is like. Because I firmly believe that the work that's happening with psychedelics at the individual level is only the first step of the process. And if we're not also working to help educate families and communities and systems that are surrounding the people that are getting these treatments, then we're also going to be missing a key piece of the puzzle in how people can move forward into the integration process successfully. And I think that's a big issue with Ibogaine, because so many of these treatments are happening outside of the US, but almost all the patients are coming from the US to access these treatments. So the integration process, what happens when people go home, when they come back to the US and they're back in their home environment, largely with systems that don't know anything about it. They don't know that what their loved one just did was safe. They don't know what is kind of unfolding for that person. So I believe that we have to be tackling both sides of this equation, and not just like how do we treat people safely, how do we move them through processes in an effective way, but also how does that information that we're gathering help influence the families and the systems that are going to be interacting with these people when they come home, because they need to understand too how to talk about it, how to know what some of these data are telling us, and why maybe it was important to support them, their loved one, and even going and doing this treatment to begin with.
That's a really good point. Like characterizing the why to help support other family members or support folks provide that kind of I don't know, advanced or more informed level of support. That's huge. Yeah, that's interesting. So who are you working with on the survey
So
right
we
now in terms
launched
of the
this
team?
survey in collaboration with Dr. Deborah Mash, who most people are pretty familiar with, someone who's been in the Ibogaine space for decades. Deborah and I connected, gosh, I think about 3 or 4 years ago to initially kind of start talking about this idea. And we ended up partnering with the Hoover Foundation, which is a nonprofit grant-making institution here in Ohio, who was particularly interested in funding something something like this. From what we can tell, we're the only psychedelic related project they've ever funded. A lot of the work that they do is actually in ecological conservation research, and this kind of fit somehow, some way with what they were interested in. I think a lot of it was really through the relationship that some of the people at this foundation had with Deborah, and so they have funded us for the last 3 years to do this work. We spent the first year and a half really sitting, kind of thoughtfully in the planning process. We wanted to make sure that all the things that we've already talked about, that we were going to be able to have the right kind of data. So we did a lot of, drafting of that survey, a lot of consultation with people who had expertise with FDA regulated research, and kind of sitting thoughtfully with the question of how long the survey is and keeping it as brief as possible while still having the type of data we needed. And then going through a pretty elaborate kind of testing process and in order to launch it. The other thing that was also really cool about this, which is different than a lot of the data that's being collected, at the clinic level or at kind of the program level that's out there right now, is we wanted to get IRB approvals in place that have all of the research ethics evaluated ahead of time, rather than how some of these projects are done, which is they do that on the back end. They'll kind of gather data in the real world setting, but then it can't really be used for research until it goes and gets IRB approval. The challenge with that is that it wasn't collected from a way that already embedded those research processes into the system. So we decided to do all of that on the front end in order to kind of deal with some of those ethical challenges right from the start. So Deborah and I and my team here at OSU are the primary partners in this work. And then in kind of towards that 1.5 year mark to 2.5 year mark, really where we've been the last year of the project, has been in starting to promote the survey, let people know about it, start to develop some of these relationships with places like Iboga Wellness Center, Inner Realms, a variety of other Ibogaine clinics. And we're still in that process. I mean, right now we are actively working with integration communications to help kind of continue to build this really robust network of partnerships and connections to get the word out.
That's great. And are people, so like the hot topic today in psychedelia is safety, right? And I'm glad. I think in the case of Ibogaine, of course, we have to even talk extra about safety on account of, at the very least, the common cardiac issue we discuss. How do you see any kind of knee-jerk reaction from people in the Ibogaine business, not necessarily wanting to have additional safety data, like because they fear it might get in the way of their business?
I do wonder about that. I don't think that I've heard anything like directly about that. Of course, that would be a pretty bold thing for someone to say directly to me, but I do wonder about the challenges that we've had with getting some of these, especially some of these bigger clinics and some of these folks on board. Is I do wonder what part of their hesitation or kind of navigating that might be influenced by independent data that's gathered that doesn't have a vested interest in a promotional aspect for how that data might be used and what that might say. I think the case though is that for the clinics that are coming at this from both a certainly from a business perspective, because they're all businesses, but for those businesses that also recognize that transparency is important and that their business is only going to be better if they can be transparent and authentic with the patients that are coming into their clinics. I think that the argument can still win out of the independence of that data collection can still ultimately I think show something that's positive. But we do know that there are deaths that have happened in the Ibogaine space from people who were either not screened properly or not monitored properly. And I think that because of those risks, I think there might be some hesitation from some places in terms of what things might show. What's interesting about this though is that we're only going to get data from the people that decide to participate, and we want the whole range of of perspectives. We want patients who had positive experiences. We also want patients who had negative experiences, and everything in between. And I think for some, especially for those who are, looking to bring in capital to grow businesses, or who are looking to market their programs as, highly effective, that might present, a bit of an ethical challenge of how to do that. Ultimately, that's one of the reasons why, our strategy has always been, not just to partner with clinics, but also to try to to communicate directly to these folks, so that they know that regardless of what clinic they've gone to or when it was, they can participate in our survey without their clinic's, oversight of it or buy into it. Certainly, it would probably be easier for us if, we had every single clinic on board and promoting this widely with their patients. That would certainly help. But it's also why we want everyone else, to know that they don't have to do this through their clinic. They can just do it directly with us if they want to.
Yeah, that's beautiful. I really think there's this concept that's been batted around a bit around some sort of IP commons. And I really, that's a step in the right direction, because, it's sort of in a vein, kind of what you're doing with university work and publishing it, so everybody has access and can learn from it and execute on it in different ways. Like forcing companies to create all of their own data when we could share. I don't know. That seems like a waste right now, when we need every advantage we can get on the planet. So let's start sharing a little more.
Absolutely. That sharing is so important. And for me, it's partly what I think these medicines are communicating to us. It's certainly something that comes up quite a bit in our clinical trial work and in the surveys that we've done, are people talking about feeling, connected with themselves and with others in a new way, and feeling like they want to integrate these relationships socially in a new way, reconnect to communities or to people that are important to them. And I think that we should be reflecting those same systems that are developing in the way that the work is done. And so the more that we can start to break down the barriers between capitalistic, endeavors and academic endeavors and community endeavors, I think the more successful it'll be. For me, it kind of goes back to the point I made about, it's important what we're doing at the individual level, but I think it's more important about what impact this might have at the community level, or at the societal level, or maybe even at the global level someday. But to accomplish that, we're going to have a lot less barriers in place between all of these different systems. It's one of the reasons why, my center here at OSU, in all of the research that we're doing, we are striving to decrease those barriers between academic spaces, community spaces, and education spaces. Ultimately, I think that this work will be most successful when we don't have these barriers in place, when we have, these processes happening in tandem, where community is involved in the research that's going as equal stakeholders, that we can develop ways in which for those processes to unfold. And we see this unfolding in some places already, where, community-based participatory research methods are becoming, more of interest, I think, to some psychedelic research spaces, which is great. I think the company side of psychedelics also, will need to come along in that in order to make it successful. And there's a lot of reasons, why they don't, I think, currently. But I think that, that's going to be a major barrier to the success of this work, and to the types of impact we can have, globally and in our families and communities and cultures, if we don't have those barriers removed or reduced.
Yeah. So what what have been some special considerations here in your survey around the safety issues around Ibogaine? Like, are you asking cardiac issue or about cardiac screenings or anything like that?
Yeah, we're asking about, kind of the basic information about, where they had their experience, any information they have about dosing or how many exposures, those kinds of things. We're also asking about medical complications and other types of issues that may have come up during their experience. And we're also asking about the positive side as well. We want to know the whole range of the experiences, because we know that These experiences can be varied. We know that, the cardio risks are certainly, a piece of that. But also there's a lot of other experiences that people have that can be destabilizing. Some of the visual experiences, these kind of dreamlike vision states that people can be in, can often be pretty challenging, especially with, a lot of the people reporting that, those visions can take on, past trauma memories or other, challenges that they've had in their life. It can be kind of a really kind of an aggressive psychedelic experience from how it's reported. And so, all of those are also things that we're asking about in order to kind of understand both the biomedical safety as well as the psychological safety. Ultimately, I personally believe that, in the future of psychedelic medicine, these different substances will likely have a different place for the right person at the right time with the right type of problem. There'll be a good fit and a good match for what they're ready for and what the system is ready to help them integrate afterwards. And the Ibogaine experiences might have a particular relevance for substance use disorder treatment. But we also might find that, ultimately, maybe the safety risks only outweigh the benefits in certain subpopulations in this addiction treatment world. It might be specifically for, people who have, co-occurring conditions where, it's been really difficult to make traction in their recovery in the past, or for people who are, very dependent on, drugs that have these, very protracted and intense withdrawal symptoms or syndromes. So I think that that's really helpful for us to start to disentangle some of those answers at this stage. I don't think that our survey is going to solve that question for us, but I think it starts to help lay the groundwork for the variety of different ways that people have experienced this, which can then, I think, inform not just, getting approval to do a clinical trial, but also can help improve the design of those trials so that the investigators can start thinking about, okay, who are the people who are best, poised to benefit from this, and who are those who are maybe not best poised to benefit from this, and how can we start to think about that as we're designing the trials, as we're creating the inclusion and exclusion criteria for different groups, and hopefully in how we design which community partners we're going to work with. Maybe we find from this that veterans are, really, great fit for this type of work. We might also find that it's only certain types of veterans with certain types of problems. So I think this is just the first step in trying to get at that, but hopefully can start to continue that conversation as trials unfold, which I do anticipate will start happening in the next couple of years. I mean, it seems like there's a lot of momentum with these state level initiatives, a lot of work by Brian Hubbard and the Reed Foundation and Marcus and Amber Capone, other people who are all kind of pursuing this largely in Texas right now, where there seems to be quite a bit of momentum. So I anticipate that at some point, some pretty large amounts of money are probably going to flood into this space. And so anything that I can do or that our team can do to try to help inform best practices and try to help inform some of these decisions, going into it, I feel like we'll be doing, our best to be able to contribute in that way.
And I think it's good to be aware about this kind of thing where when all this money comes in, sometimes science can get a little underwater, and have a lot of, it's better to do this stuff as early and as often as possible so that we have a much sturdier foundation as we try to build out whatever this thing is that it's going to become. And that might be a spin for us here. Do you get the sense that there could be some sort of federally regulated, other than clinical regulated access program for Ibogaine? And like the attention that some of the parties are giving it make it seem like it could be available before any kind of FDA approval. But what's your sense on that?
Well, it would be difficult for me to see how that could happen at the federal level, although I suppose anything is possible. At the state level, I think it's very possible that we'll start seeing, and I think already are seeing in some states, some movement towards that at the state level. Part of the challenge that I see with this pathway of state level jurisdictional changes and work that needs to happen at the federal level, are that those state level initiatives, a lot of times, like when we see what's happening in Oregon and in Colorado, a lot of times these businesses, which even if we take out the potential complications of interest and conflict of interest that goes into wanting to do it, I try to believe that, like, generally speaking, most people are really trying to just make sure that we can provide good treatment to people that need it, right? So in the best case of circumstances, in these places where we're seeing access change for psychedelic medicines, um, it's already hard enough. It's already hard enough to do good psychedelic treatment work. As someone who has been involved in numerous trials at this point, and working a lot directly also myself as a clinician, I know that it takes a lot of cognitive and emotional effort to provide these treatments. And when they work well, I think that there's a correlation between how much effort and emotional and cognitive space has gone into to creating those environments and doing it safely and doing adequate screening and preparation and integration work. To me, that's really where these treatments succeed or fail. It's not in the psychedelic experience itself. The psychedelic experience is so varied and kind of idiosyncratic to an individual that it to me, that's just the catalyst for all of this other deep work that unfolds in these spaces. So assuming that these spaces are knowledgeable about that, and they're trying to do their best to just create access for people ahead of federal changes, we're adding in so many complications in terms of banking, legal issues, access issues, sourcing the substance issues, operating kind of in gray areas in some spaces, certainly, banking being one of the big ones, opening ourselves up to risk, in business environments for things that might happen that don't go well, or when things, are done maybe and mistakes are made, opening up to malpractice lawsuits. Like there's so many risks involved that just complicate our capacity to do good clinical work, that I worry about, that moving too far ahead of what's happening with clinical trials in particular. I've been less worried about it with psilocybin, because with psilocybin we already have so much data to suggest that it's generally very safe. Both clinical trial data and survey data for decades and decades of research that's happened. With Ibogaine, we don't have that yet. We don't really have the same level of certainty about some of these questions, and we don't even have any large scale clinical trials that have been completed yet, like we do with psilocybin or MDMA. So I think without that, I worry that it's a little bit too fast, too soon. I think that people are going to be, already struggling to keep up with the demand of how many people are going to want an Ibogaine treatment. And the complexity of those populations, specifically people with, protracted, serious, severe substance use disorders, that is not easy work. And just having an Ibogaine experience is not going to, radically make, all of those problems go away. In fact, if anything, it's going to open up a very long integration process that is going to need ongoing support, whether through peers, like something like Psychedelics in Recovery, or other peer support groups. And so I worry about it getting too far ahead too soon, and then opening up potential for risk for people.
Yeah, I appreciate that, and I'm with you on the psilocybin mushrooms thing. I was at an event in DC the other day, and Gouldalin had a chance to talk, and I liked her kind of getting ahead of, well, commerce getting too far ahead makes it really difficult to understand mechanism of action. Which I think that could be a long way off too. Us really having a grip on that. So I don't know. Do you have any thoughts on the actual science versus like the safety?
Well, I think that's a great point that she made, because it's tricky, because, part of what's driving the corporate interest is the public interest. Like, people are suffering, and the things that they have access to are not working for a lot of people. So in part it's this corporate interest, and kind of, starting to build the money-making endeavor of this space. But supply and demand tell us that, like, yeah, it's because the population wants it. It's because the people are clamoring for options that can give them the relief that they're looking for, that can open up new pathways for them. And so, yeah, that push and pull between those interests definitely complicates science. If anything, it actually, I think, complicates it complicates doing science thoughtfully and objectively. I think one of the challenges that I've had as a psychedelic researcher is trying to stay on top of my own bias and my own objectivity in the work that we're doing, especially as someone who, I think like a lot of researchers, but certainly a lot of clinician researchers, a lot of us got interested in clinical research because of our own families or even our own personal issues with substance use or mental health problems or trauma. I'm someone who survived some of my own traumatic experiences, and so firsthand, I have to recognize that going into any endeavor I do, I'm already bringing in a bias of that's limiting my objectivity. And regardless of how much I stay on top of it and can be aware of it and try to open up, my own viewpoint to kind of be able to see multiple perspectives, that's still embedded in the work that I'm doing. That's not unique to this work. That's a lot of people go into academic fields of inquiry because of their personal lived experience, and people who are studying human trafficking, a lot of them have had their own personal experiences, or they've had experiences with people that they care about. So these biases exist, but it's hard enough to navigate that as a objective researcher, before adding in all of the competing interests of the capitalistic environment and sponsors and the interests of these companies to then promote work or to sponsor work. I've taken a very personally, I've taken a very conservative approach to my work here at OSU in terms of working with any type of sponsor. In fact, almost all of the opportunities that we've been presented with to work with kind of for-profit industry sponsors of psychedelic research, we've turned down. And in part, we've done that because it's already hard enough to do the work to manage the biases that we know we're bringing into it, that I don't want to have to then navigate the biases that someone else is doing to bring into the equation, let alone the fiscal interests that then are largely going to drive the system and what we're focusing on, the types of questions that we're asking, the things that we're doing, how quickly and thoughtfully and safely we're doing it. And that's not to say that can't work, that process has to unfold, if we're going to have something approved at the federal level. But I just personally believe that, these ethical issues are so inherent in science, but they're especially inherent in psychedelic research, where we're bringing people in, we're increasing their vulnerability, and then the likelihood of challenges coming up because of that are I think magnified more so than other academic inquiry spaces. So yeah, it's definitely a challenge, and there's no right or wrong answer, but that's the approach that I've taken.
Cool. Can you hear me?
Mhm.
Yeah, great. So I'm curious around. This is the first. I'll deviate super far from this, but there's relation. So we were chatting about this like IP Commons issue earlier, and this kind of partnership concept. I wonder about ketamine, for instance, right? Like we've got Spravato out there. It's fine. It's a little overpriced, or a lot overpriced. But what do you see any kind of sharing or partnerships happening across research organizations with ketamine to try to get psychiatric use cases covered at all?
I don't know. I'm a little bit removed from the ketamine space, although it is something of interest just to see how that's unfolding as potentially from my perspective, potentially a challenging model to try to replicate with other psychedelics. I think one of the biggest issues that I see is more of this kind of more of like a stakeholder kind of claim of like, ketamine in general being kind of a solution, especially without any kind of therapy or preparation or integration work. And so I see kind of this like more of this pharmaceutical, pursuit of like, okay, well, here's another drug. We're going to treat your symptoms with this drug, and then you're going to be fine. Which of course we know not only from ketamine research that that's not true, but we also know from the lived experiences of people going through these treatments that it's not necessarily true. That being said, I think there are some, people who have, more of an openness to this idea of sharing and being more collaborative across clinics or across systems happening at the community level. It's probably happening more at the, with different clinics trying to collaborate and create openness rather than at the corporate level. At the corporate level, I feel like it's more about protecting investment and investors than it is about really trying to find solutions. Part of the issue that we're going to have, I just read some numbers recently about just like pharma's lobbying power in DC, especially over the last 10 years, is that there is no incentive for them to break down the barriers around IP. There's no reason for them to do it financially. So I think the only argument that we really have outside of a financial one is really from an insurer perspective or from a consumer perspective. What are people going to be willing to pay for, or what are insurers going to be willing to pay for? And if we can start to show that these collaborative processes, or that processes that involve a breakdown of those barriers, and that we can show with evidence that patients do better when their clinics are integrated, when their providers are integrated, when their providers and their communities are integrated. If we can start to show that kind of data, that there's a cost savings, then I think we can start to speak the language of the consumer side of things and the insurer side of things, that then can start to dictate, well, we'll pay for it, but only under these conditions. And that might then help to move the needle, I think, from the corporate side of things. But otherwise, I think it's going to be very difficult to convince them that they should change their approach, at least in the short term. I feel like that's a very difficult argument to make.
Yeah. Yeah. Thanks for that. Yeah, I saw some recent puff pieces on Christian Engermeyer, and like he's certainly incentivized to like hold a lot of IP and not share. And it's just, the nature of the scenario we're living in. So I would hope smaller cap pharma might want to actually collaborate with each other. So if you want anybody to act as a hub, putting out my hand, let me know.
So that was part of what I was getting at earlier about the systems level change that needs to occur for these things to be successful. Like I would put corporate into those systems that ultimately are, I believe, partly responsible for how we got into this predicament to begin with, right? And so long as those don't change, I think that we're only going to be so effective. We're not going to be able to realize, I think, the full potential of the healing power of psychedelic medicine until we start to also see changes and breakdowns in those systems. Because ultimately, we can't treat a symptom of a problem that exists because of something that isn't ultimately willing to change their approach or the creation of that symptom to begin with.
Right. I would wholeheartedly agree. It's a really complex one we're dealing with. So back to your survey. So again, anybody's welcome that's participated with Ibogaine?
Anybody who's had an Ibogaine experience, and I want to point out too, there's a lot of clinics now that provide more than Ibogaine, sometimes in the same retreat or treatment setting. This is also for them. As long as they've had a treatment with Ibogaine, regardless of anything else, they can participate. The easiest way to access the survey, we have a standalone website for the survey. It's ibogainepatientsurvey.org. That survey, or that website, provides a direct link into the survey. It also provides a little information about our team and some of our partners that we've been able to establish already. And so people can participate via that.
Great. And let's see. Are you looking for just anybody? You're not, no population specifically.
We're looking for everyone. I mean, there's a lot of the momentum that's happening, I think, for some of these first clinical trials are probably going to be either with veterans with mental health and TBI problems, and also people with opioid use disorder. So I would say, those are some of the populations that we have a particular interest in, just because there's quite a bit of momentum currently to try to do trials with people in those spaces. But if someone went for Ibogaine treatment because of alcohol misuse, or if they went to Ibogaine treatment for, some other depression or something else, they're absolutely still included. We have, the ability in the survey to, the questions fit for anybody. So we have built into the survey our ability to kind of break down these different subgroups down the road when we have the data. So hopefully eventually we'll have, a subgroup of people that, are veterans with PTSD that had Ibogaine, and we'll have a subgroup of people who had opiate use problems. Some of them might have depression problems. So we can break down all of that, but we've built that all into the survey ahead of time so that anybody for any reason that they've sought out Ibogaine can participate in this and share their data.
Outstanding. And cool. So anybody that's like, I guarantee there's 100 people going to do Ibogaine tomorrow, right? And so they could theoretically participate a day or two after. Hopefully, do appropriate integration, everybody first. But yeah, no time restraint on the distance. Cool.
Absolutely, yeah. Anytime after they've had the experience. So for anybody who's are planning to have an Ibogaine experience coming up in the near future, or even longer than that, you can participate the next day if you want to. You can take the link with you, participate the next day. You can also wait a couple weeks, let things settle, and participate then. There's no time limit on how long, after your Ibogaine experience that you need to wait to fill out the survey. So whatever works for an individual, whenever they have the space to click the link and go answer some questions, will work, whether that's a day later or weeks or months later, or even for some people years later.
Cool. I love that. And plant and molecule. So full Ibogaine, and then also the plant root.
Yes, we have questions embedded in the survey. We have heard, just for full transparency, we have heard that for some people who've had the plant, who have really had an Iboga experience and not necessarily an Ibogaine experience, that some of the questions are a little bit confusing. In part, we did that because, what's likely to come through an approval process at the FDA is the Ibogaine and not necessarily the plant matter in that way. So the questions were kind of geared a little bit more towards that, but it still is open and inclusive. And so anybody who's had these experiences, regardless of the type of the means of how they consumed it, can participate.
Great. And I think that might be all the questions I have about the study. Is there anything else I might have missed about the study that people might want to know about?
Well, I'll mention the last thing I can think of, which is that, this is something that we anticipate, being an ongoing thing, an ongoing offering. So, if anybody comes across this, months from now or a year from now or more, our plan is to continue having this data collected ongoing. And then what we're going to plan to do is, after we reach a certain number of people, we can start to publish some of this data to make it available. But also we want folks to know, like, if you're, if you're a researcher or someone else who is pursuing something that, this data would be helpful for you to have to be able to move your work forward. We're also open for those people to reach out to us. And once we have the data, we'll do what we can to share that data, to make sure that it's accessible, both for publishing and dissemination, and also for ongoing work that people pursue.
Amazing. And would they reach out to you for that, or the department or center?
Yep, they can reach out to me or the center, and we'll connect them into the process. We're probably, I would say, but we're at least currently we have 86 people who've completed the survey. So that's an exciting start. We probably need to have at least a couple hundred before we're able to really do something meaningful with the data. Certainly having a couple thousand would really kind of grease the wheels of doing some things with it. But yeah, so we might not be able, right away to share some things to make it meaningful for what they might need. But hopefully in the coming months, we'll kind of reach that initial threshold of having the minimum of what we need to really be able to start moving that forward.
Yeah, great. And there's a question in the chat, and I'm not sure if you have this kind of specialty. Somebody on YouTube's asking this. Do you know of anybody with clinical experience with Ibogaine specifically treating pain, like nosoplastic pain syndromes, like phantom limb or fibromyalgia? Like, I have some things to say, but I want to hear if you know of anything.
Yeah. Well, not directly in terms of, like, we haven't focused on that question. We have started to ask that question in some of the other survey work that we've done, specifically with veterans who are going to receive psychedelic therapy. A lot of them in our studies, because of the pipeline and the work that we've done, are going to get Ibogaine treatment. And so we do have some variables around pain and the experience of pain, not necessarily specific pain syndromes, but just more generally. So I don't have a lot of answers yet. I certainly haven't published anything yet, but the little bit of looking at the data that we've done suggests that there might be some improvements in pain perception. So, and then that would go along with, anti-inflammatory properties of some of these experiences, and also just kind of what we've seen with other psychedelics in people's capacity to see their symptoms in new ways, which I think is important for this question around pain, because often so much of someone's experience of pain is from their own perspective of the experience, right? And that's one of the reasons why there aren't like a lot of like gold standard measures of pain that we can understand across different people. But what we see with mental health symptoms is that psychedelics often change people's orientation to the symptoms that they're having, even if their symptoms persist and don't go away. When we, for example, we recently did this 5-year follow-up of our depression trial participants at Hopkins. And one of the things that was really interesting is when we talked to the people who their depression came back, one of the things that was kind of predominant in that data was people's reports that, well, yes, my depression came back, but my experience of it is different. Like, I don't view it the same way as I did before. And so therefore my lived experience has changed, and I'm better kind of able to still pursue the things that are important to me. I have a feeling that there's going to be something similar that starts to show the same thing about pain syndromes, but the research, I think, is still kind of lagging in that space. So hopefully more to come on that, but I do think that there's reason to be optimistic potentially. But I'm curious what you think, Joe, because you mentioned you have some thoughts about it.
Right. I am founding board member of the Psychedelics and Pain Association. That's an offshoot. I was incubated by Cluster Busters, and we have coordinated with a lot of leading pain researchers to put out a free open source curriculum on what we know about pain and what we know about psychedelics and their intersection. So free program, anybody can snag that, psychedelicsandpain.org. Ibogaine, to me, is the one we're most optimistic about having the best performance, but we haven't been able to do trials yet for a lot of reasons, including money. And we have been able to publish a few things. Some of the team has, and it's been pretty interesting to see nosoplastic pain conditions get cut down drastically. And I would say the most important, or I don't know, influential case study was Albert Lin at UCSD with V.S. Ramachandran and a few of the others at the UCSD, I guess, Psychedelic Center. This might have been before the center was even established at UCSD. So there's a lot of really good preliminary data, and they're always looking for new case reports to document and publish on.
Well, we might need to chat about that, because we're just wrapping up a 3-year study of veterans who are going, most of them going to get Ibogaine treatment. And this is the first time that we've embedded pain measures, and we followed them from pre-treatment all the way to 9 months after their Ibogaine treatment. So we haven't looked specifically into that data yet, but we're getting ready to start doing that. And so I'm curious even more now than I was before our conversation about looking to see what some of that data shows. We have about 155 people where we've tracked them up to 9 months after their treatment.
Oh, wow. That's outstanding. I love that you have that level of pain data. So we received some initial funding from the Cohen Foundation, I think in 24. I think we were awarded some more for 25. So we're looking for collaborators, partners, donors, the usual, to hopefully accelerate how psychedelics are looked at for pain. And Alan, one of my interests is, how do we make sure that psychedelics aren't pigeonholed into a psychotherapy exclusively? Yes, we need to be doing it with psychotherapy. The Cluster Busters population showed really clearly that patients can take home their own medication and do just fine. Near zero diversion, and negative reports are really low in that population. And they were abandoned effectively, like subpar treatments. So
it's such an important point, though. I mean, a lot of my a lot of my work has involved, kind of complex mental health populations that the psychotherapy I think really is critical. And we know from a lot of other work that's happening in naturalistic environments and in other populations that are using these medicines that the psychotherapy is not necessarily an active ingredient of what's going to be helpful for everybody, right? So to me, that's also really important that we highlight, and I'm glad you mentioned it because I do think that there's going to eventually be I think a world where access to psychedelics should not be solely regulated within, a very intense psychotherapeutic environment. But figuring out how to do that in a way that is best supportive. One of the things that I wonder about, which, I don't know a lot about cluster busters, but the little bit that I know of is that they've also created some of their own internal protocols. And because of their peer support network and the work that's kind of emerged in that space, and that's so important, right? That lived experience is so important to help guide some of those future protocols that we know, when someone comes into a clinic and says this might be a problem they have, that there's resources for them, that don't have to be necessarily managed, by a therapist. Maybe it's supported initially just to kind of get them the resources that they need, but that can be managed in that way. Yeah, such a great offering. I'm excited that you're doing that
Yeah.
work.
Yeah, thank you. And furthering your point, like I wonder if there's a um, some sort of measures we could create and then implement. Say, oh yes, I guess you are ready for at home. And to me, that seems like a clinically appropriate thing to be, thinking forward towards. Um, yeah, we'll see. We'll really see how this all shakes out. If anybody's curious on to learn about cluster busters, I think it's Johanna Kempner put out a book called Psychedelic Outlaws. It's like kind of did their history. She's a I think medical anthropologist or sociologist out of Rutgers, maybe now at NYU. Fascinating person. I loved her work there. Her treatment of cluster busters is great. And yeah, Alan, I'm glad that you're interested in pain too. I reached out to somebody from Walter Reed to ask if they could include pain measures as well. So I'll suggest that other groups like yours are doing it also.
Yeah.
Just
Well, I
yeah,
think it's
to be
just
really helpful.
it's really high time that a lot of the research starts to reflect the needs in these different communities because we certainly have our own interests as researchers in what we're doing, but it's usually not very expensive to add in surveys here and there alongside the core part of a study. Like in our experience, like those pain measures, they're quick, they're easy, it's not really time intensive for people. So I really hope that as we continue to move forward over the next couple of years, that researchers become more open to listening to communities that are in psychedelic spaces, listening to where these unmet needs are, and being open to gathering that type of data, even if they don't anticipate using it. One of the reasons why I think I've been able to be successful in my career in psychedelic research and clinical work is because of my openness to also letting other people use that data. like part of our ability to publish more and get more out there on different nuanced topics is by opening up our opportunities to students who might want to study these new interesting topics, or opening up to other researchers who maybe don't have the resources at their institution to do psychedelic research, or they don't have the skills yet to do their own survey, but they absolutely could analyze data or write a paper about pain. So that's been my approach, is to try to be as open as possible, to trying to be as inclusive as possible in the work that I'm doing, with the intention of like, okay, well, maybe we'll come across the right person at the right time who can use that data and really make something meaningful come from it.
Yeah, I love that, and I'm glad we were able to get a little meta here on the import of research. It's huge. We're not really doing infectious disease research as much as we did before. I'm glad we're going to be able to do some psychedelic research, and yeah, I think we're going to have some really interesting movement in our space, hopefully for the better over the next handful of years. And thanks
Yeah.
for playing a part.
Thank you.
Yeah, and where can people find the study other than the links I'll put up everywhere?
Yes, you can find the study. Honestly, if you just Google Ibogaine patient survey, I think we come up pretty easily right now, which is great. It's ibogainepatientsurvey.org. People can also find it if they end up finding our center website. We've got it listed at cpdre.org, which is the Center for Psychedelic Drug Research and Education. And it's also starting to become we're starting to try to get it out in a variety of different newsletters. I think it just recently went out in like the Psychedelic Alpha newsletter and in some other spaces on social media. So people might start coming across it in different places, which is great, and they can click over and participate. If for some reason someone can't find the link to the survey, they can reach out directly to me. I'm usually pretty easily to find my email address online here at OSU. People can reach out directly to me, and I'm happy to point them in the right direction.
Amazing. Well, Alan, thanks for everything you're doing over there. Really appreciate all the hard work you've done for a very long period of time, and I hope you can keep it going.
Thank you. I really appreciate meeting with you today. Thank you.
Thanks.